Welcome. I am Terry Tropin, and today I am presenting a lesson on ICD-10-CM coding for sepsis. Let me start with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus, and I have RHIA and CCSP certification. I am also an AHIMA-approved ICD-10 trainer. I have taught health information technology at Montgomery College for over 20 years. I've also written some books on coding. These books are study guides that summarize the coding guidelines. My books include one for E&M coding, one for ICD-10-CM, one for PCS, and one for external cause coding. These are available from Amazon. First of all, we define our terms. Very important. Sepsis is a systemic infection, meaning includes many different body systems, including organisms in the bloodstream. Bacteremia and septicemia are coded as sepsis. Severe sepsis is that systemic infection, but it goes a step further to include acute organ dysfunction. Septic shock is a circulatory failure associated with severe sepsis. Sepsis and severe sepsis due to non-infectious process. Non-infectious process refers to a burn or other injury which may or may not lead to an infection. A systemic inflammatory response syndrome, known as SIRS, may be due to an infectious condition or a non-infection process, again, the burn trauma, which may or may not lead to an infection. A physician may document that a patient has sepsis and related multiple organ dysfunctions. This is coded as severe sepsis. Remember that there was sepsis and there was severe sepsis, and the difference between the two was the organ dysfunctions. So if it says organ dysfunctions related to the sepsis, then that's severe sepsis. Don't use a code from subcategory R65 in the symptoms and signs chapter unless the term severe sepsis or SIRS is documented. Now, another thing I want to show you throughout this presentation, you see this right down here, this notation, that refers you to the guidelines in the ICD-10-CM book where this information is drawn from. So here's some more important guidelines for coding sepsis. The physician may document that the patient has sepsis, but the blood culture results are either negative or inconclusive. This can still be coded as sepsis, but you should query the physician. If the physician says, yes, this is sepsis, then use a code for sepsis regardless of the lab results. Another guideline states that the acute organ dysfunction must be clearly associated with the sepsis in order to code severe sepsis. So a patient may have sepsis and have acute organ dysfunction, but the two may not be a cause and effect. The organ dysfunction may be due to something else. If it's not clear in the documentation, again, ask the physician. So coding guidelines differ for sepsis and severe sepsis. If the documentation states sepsis, use a code from the infections chapter only or sepsis unspecified. Do not list a code from R65 in the symptoms section. If the documentation states severe sepsis, then you're going to use an R65.2 code. If it's without septic shock, it's 2.0. If it's with septic shock, it's 2.1. Coding severe sepsis requires at least 2 codes, often 3. First, you code the underlying cause, the infection. Then a code from R65.2 from the symptoms chapter. And then a code for associated organ dysfunctions if appropriate. Okay. The most important thing to remember is codes from R65 can never be principal diagnosis, and you can only choose one code from the R65 category. sequencing severe sepsis. There are a lot of guidelines on sequencing these. So sequencing codes depends on the circumstances. So first, if the severe sepsis is present when the patient is admitted to the hospital, list first a code for the underlying systemic infection from the first chapter in your ICD-10 book. Then list code R65.2. So you list a code for the infection and then a code that adds the information that this is severe sepsis. Then you're going to list codes for any associated organ dysfunction. So that's if the patient has severe sepsis when they're admitted. If the severe sepsis develops after the patient is admitted, list first the other reason the patient was admitted. Maybe it's a local infection, could be something else. Then code the underlying systemic infection and then the R65.2. Finally, list a code for any organ dysfunction if documented. If the admission is for a localized infection, all the patient has is a localized infection when they're admitted, but after admission to the hospital, they develop sepsis or severe sepsis. Code first the localized infection, then sepsis, severe sepsis as appropriate, then then associated organ dysfunction if appropriate. On the other hand, if the sepsis or severe sepsis and a localized infection are present when the patient is admitted, code first the underlying systemic infection, then the localized infection, and then R65.2 if it's severe sepsis. Septic shock is always coded as severe sepsis. Remember, septic shock was defined as a failure of the cardiovascular system. This is always severe sepsis. The guidelines state the underlying systemic infection is listed first. The specific code will vary according to circumstances. In most cases, you're going to use a code from Chapter 1, infections. Other possibilities are T81.4 if the infection is following a procedure. Another possibility is 086 if the infection is peripheral. Then you're going to code for the associated organ dysfunction. Remember, septic shock can never be listed first. So let's summarize what we've done so far. For sepsis, list only a code for the underlying infection and/or the localized infection. Do not use a code from R65. For severe sepsis, list first a code for the underlying infection and then a code from R65 category. List additional codes for any organ dysfunction or localized infections. If the documentation states sepsis with related organ dysfunction, code is severe sepsis. If the organ dysfunction is not listed as directly related to the sepsis, ask the physician for clarification. If the patient is admitted with sepsis and a localized infection, list first the code for the underlying infection and then a code for the localized infection. Use code R65.2 for severe sepsis, if it's severe sepsis. If the patient is admitted with localized infection, but which develops into sepsis during the hospital stay, so that when they come in, they only have a localized infection, but it develops into sepsis during the hospital stay, list first the localized infection, because that's why they were admitted, then a code for the systemic infection and R65.2 if it's severe sepsis. Septic shock is assumed to be severe sepsis. List first a code for the systemic infection, then R65.2, severe sepsis with septic shock, and then codes for any organ dysfunction. So here's a practice. If you want to play along with the practice, listen to the question and then stop this recording. After you have selected your codes, start the recording again to check your answers. So practice 1. Patient is diagnosed with sepsis due to methicillin staphylococcus aureus, MRSA. So turn off the recording and see what you come up with. So the correct answer is A41.02. This is sepsis, not severe sepsis. So you're only going to do a code from the infection chapter. There's a combination code for sepsis with MRSA, so only this one code is listed. How did we find this? Sepsis, Staphylococcus aureus methicillin resistant, which refers you to A41.02. Okay, let's try another one. Again, listen to the question, turn off the recording, and see if you can code it on your own. Severe sepsis due to enterococcus with septic shock causing acute kidney failure. Okay, so 3 codes this time. So we have severe sepsis, A41.81, and then R65.21, and then a code for the renal failure. So remember, R65 cannot be listed first, so you list the A41.81 first. You find shock septic, which refers you to due to severe sepsis, which refers you to R65.21. You can also go to sepsis severe with septic shock and be referred to the same code. In the alphabetic index, find sepsis enterococcus, which refers you to A41.81, and then you find failure kidney or failure renal, which takes you to N17.9. Coding SIRS. Coding depends on whether the condition is due to an infectious or a non-infectious condition, and we talked about what that non-infectious condition means. SIRS, you remember, is systemic inflammatory response syndrome. If it's SIRS due to infection, code only for the infection. So you're not going to use a code from the R65 category, only a code from Chapter 1 for the infection. If SIRS is due to a non-infectious process, it depends on whether or not the condition becomes infection later on. If it's, for example, a burn, which can become infected, right? If it does not, use a code for the injury or other infectious condition, and then R65.1. If the non-infectious condition becomes infected, code for the injury or other condition and for the infection. Now, it will depend which code is listed first, because it'll depend on the circumstances of admission. What's the main reason the patient is being seen? Okay. If it's not clear, or if both are equally the reason, you can pick one. You get to choose. One of those rare instances in ICD-10 where the coder gets to choose what is first. So here's a little comparison of sepsis, severe sepsis, and SIRS. Note that severe sepsis may or may not include septic shock. Note that SIRS may or may not include acute organ dysfunction. Remember, again, list only one code from category 65, and R65 codes can never, ever, ever be listed first. So let's do another practice. Again, turn off the recording and try coding it yourself. Patient, 82 years old, had been in a yard gardening all day in a usually warm August. She fainted and was taken by a neighbor to the emergency room. The ER physician diagnosed heat stroke with acute respiratory failure, SIRS. First of all, first question you ask yourself, was this SIRS infectious or non-infectious? So turn off the recording and see how you code this. So the answers are T67.01XA, R65.11, and J96.0. Okay. Now there are notes under R65 to remind you, code first underlying condition, in this case, the heat stroke. Use additional code to identify organ dysfunction, acute respiratory failure. So that gives you the order of the codes. There's also a note under the T67 code. Use additional code to identify associated complications such as SIRS. So if you look at the notes under these codes, it leads you along the right path. Okay, so there's also sepsis, or severe sepsis, that's post-procedural, following a procedure. Make sure the documentation states that the sepsis or severe sepsis is caused by the procedure. A patient may have sepsis that is present after a procedure, but we can't assume that it's directly related to it. If it's not clear, ask the doc, okay? Code first, T81.40 to T81.43, these include the site and the depth of the infection. For example, or the incision for the surgery that is now infected. So there are different codes for superficial incision, deep incision, or incision into the organ or a body cavity. Then you do another code, T81.44, to indicate the infection. It's not just an infection, but also it's septic. So you need two codes to say that it's an infection and septic in a wound, a surgical wound. Then if it's severe sepsis, you're also going to do the R65.2, and then if there's organ dysfunction, you're going to report that also. So procedural, post-procedural with septic shock, this must be documented. Again, I keep saying this over and over again, but it must be documented that sepsis is related to the procedure. They may occur concurrently, but not be related. So you need to make sure that they are. So first code, T81.40 to T81.43 for the site of the infection, superficial, deep, into organ, into body cavity, etc. Then T81.44, sepsis following procedure, the infectious agent, the cause of the infection, post-procedural septic shock, and then any organ dysfunction if appropriate. You don't list severe sepsis with septic shock, R65.21. Look under T81.1. There's an excludes one note. So if you do T81.1, it says do not also code this one. Also, you might have infections following these procedures, infusions, injections, transfusions, immunizations. So again, it must be documented as a complication of the procedure. In this case, you would do T80.2. This category is entitled Infections Following Infusions, Transfusions, Therapeutic Injections. Okay. Then you code the infectious agent, and then severe sepsis if it's documented, and organ dysfunction if it's documented. So here's a summary of what we've covered for post-procedural conditions. Remember that the sepsis or severe sepsis must be documented as related to the procedures. Multiple codes from T81 are used, that category, one for the site of the infection, and then a code to say the infection is sepsis, and then a code for the infectious agent. So you need 3 codes for that. If appropriate, you're also going to code severe sepsis and any organ dysfunctions. So you could end up with an awful lot of codes for these circumstances. Okay, here's another practice. So turn it off so you can record it so that you can code it yourself, and then turn the recording back on. So, patient seen in emergency room with infection of superficial operative wound. The patient is septic due to operative wound infection. The physician documents sepsis due to generalized Haemophilus influenza. 2 weeks ago, she had an open appendectomy. So, first you do a T81.41XA for superficial incision. Then you do 281.44XA, post-procedural sepsis, and then A41.3 for the infection, and Z90.49, acquired absence of appendix. So this tells the whole story. She had an appendectomy. The incision was infected. It was sepsis. And the infection for the Haemophilus influenza infection. So all of these codes tell the whole story. So how do you get to these codes? We'll find infection, postoperative wound, which refers you to T81.4. You can also look up sepsis, post-procedural. In the main part of the book, you see the 7th digit A is needed. A note under T81 states you should also code for the infection. So again, there are notes throughout the book that kind of lead you to where you need to go. In the alphabetic index, find infection, Haemophilus, generalized, which refers you to A41.3. And then you can find absence, digestive organ, acquired, which refers you to Z90.49. If you were doing this and you did Q45.8, that's incorrect because that's patient was born without an appendix, not patient had an appendectomy. Very important. There is no way that you can remember all of the ICD-10-CM guidelines. Nobody can. So it's important to write notes throughout your book to jog your memory. So each time you look at a section, see where you might put a note to remember. You don't want to go thumbing through the guidelines during a test or a certification exam. So here are some suggestions of what you might do for marking up your book, what you might write in your book. Turn to R65 codes in the tabular list and write in, never list R65 codes first. Also write, use these codes only for severe sepsis. And then you might also define the infectious process, trauma, burns, neoplasms, other injuries. Also write in, organ dysfunction must be documented as due to sepsis. Now those are in there in notes or implied in notes, but if you write it in yourself, you're more likely to actually see it. And the act of writing something into your book kind of reinforces it in your own mind. Also, turn to T81.4 in the tabular list. Write in code for site and infection, T81.41 to 43, and then write in if sepsis, also list T81.44. If severe sepsis, also list R65 code. So these will help you remember to do all of the steps. There are a lot of codes in this section. Each case had a number of different codes, number of possible codes. So it's important to have that note in there. Now, in the alphabetic index, find the entries for Sakari's disease and CD. If there was an entry for SIRS, it would be there, but there's not. So we're going to write it in. So write in SIRS R65.1. Now you can look up syndrome and go through all of that, but the syndrome pages in the index go on and on and on, and it's easier just to write in SIRS R65.1. That's the easy way, the fastest way. So that completes the lesson. If you have questions or comments, please feel free to contact me. I'd love to hear from you. We have a Facebook page. We have an email address. And again, I have these books on Amazon. The easiest way to find them is to go on Amazon Books and type in my last name, Tropin. Thank you so much for listening. I hope to have more lessons up soon, and I hope you enjoyed this and learned something. Thank you very much.